Welcome to Pharmacy Friends, a podcast dedicated to bringing industry experts to the same virtual table to talk about what is happening in pharmacy today, what is coming in the future, and most importantly, what it means to you. Today, we're diving into high-cost therapy management. Rare or ultra-rare conditions are among the costliest conditions to treat. Orphan drugs expect to account for $242 billion in drug spending by 2024, or 1/5 of all prescriptions. Within the medical benefit alone, there are over 50 drugs on the market that cost more than $300,000 per year. A lack of clinical guidelines for treating patients impacted by these diseases often leads to inappropriate prescribing, as it takes specialized experience to prescribe appropriately. Enhanced utilization management is evolving with access to case management support, resulting in improved patient outcomes. And hospital readmission rates are dramatically reducing due to case management services. High-cost therapy management ensures that appropriate therapies get prescribed to the right members so that inappropriate use of medicines and unnecessary costs are avoided. So, how has the team at Blue Cross Blue Shield fared and overcome the challenges of high-cost therapy, and what stories can they tell? Hosting today's episode is Brian MacDonald, Senior Director of Specialty Clinical Strategy at Magellan Rx Management, joined by Kourteney Martinez from Blue Cross Blue Shield of Alabama. Let's get into it.
Hi, pharmacy friends. I'm Brian MacDonald, Senior Director of Specialty Clinical Strategy and Innovation here at Magellan Rx Management. I'm really excited to get the chance to host another conversation as part of our Pharmacy Friends podcast series. And today, I'm really excited to be joined by a special guest from Blue Cross and Blue Shield of Alabama. Her name is Kourteney Martinez, PharmD, and Kourteney is a pharmacy engagement specialist. Welcome, Kourteney.
Hi, everyone. Yeah, thanks, Brian. I am so happy that you guys asked me to join today. I thoroughly enjoy my role at Blue Cross Blue Shield of Alabama. I get to work with our members and our providers on various high-cost drugs and diseases under both benefits, under both the pharmacy and the medical benefits. So I stay very busy these days with all the different drugs coming out and trying to keep up. But I have really enjoyed partnering with Magellan to care for our customers on the medical side of things. So thank you. It's a privilege to chat with you today.
Likewise. And yeah, really excited to have you join us. Before we jump into today's topic that's specifically focused on management strategies around high-cost therapies, I was hoping that maybe you could give the audience a little bit of an idea about your background as a pharmacist and how you arrived at your role with Blue Cross and Blue Shield of Alabama.
Would love to. So I actually started my pharmacy career at the Veteran Affairs Outpatient Clinic in Montgomery, Alabama. So I went there straight out of college and really loved it. Very hands-on. And my husband actually took a job in Birmingham, which with that move made me look for other opportunities, of course, closer to the Birmingham area, which I ended up at Blue Cross and have never turned back. But I started Blue Cross in 2018. And I've honestly loved every minute of it. I was really nervous to begin with because I've been so hands-on in patient care for so long. I just really wasn't sure what this managed care side of pharmacy would feel like for me. But it's been an awesome balance. I get to work with providers. I get to work with members. I get to learn and experience the managed care and really grow in that area. So I feel like it suits me well. And honestly, I'm also just very thankful to be a part of Blue Cross Blue Shield of Alabama. It's a tremendous company, and I'm very grateful for what we get to do.
Very cool. Very cool. And yeah, as a former community pharmacist and long-term care pharmacist, myself, I, never imagined, certainly right out of school and even, several years into my career that I would find myself on a clinical team within managed care, focused on specialty drugs and, rare and orphan conditions. But it's amazing kind of where our paths can take us. And, as it turns out, these paths have crossed so that you and I have been able to interact a few times over the years. First via our hemophilia management program where we got to interact. And now, from that program back in 2019 to more recently, we've been partnering even more frequently on a high cost therapy solution. The timing for that couldn't be more perfect as we, both continue to see more and more high dollar treatments enter the market on both the pharmacy and the medical benefits, including, cell and gene therapies and other modalities of treatments for rare and orphan conditions. In fact, I know in our upcoming issue of the Magellan RX Trend Report, saw a couple of factoids in there about how high-cost orphan drugs saw a record high of approvals back in 2020, and the number of approvals was a 40% increase over the year before. And what we continue to see year over year is a trend that shows an increase in drug spend that's outpacing, the simultaneous increase in utilization. So, that cost per treatment is seemingly growing and growing. As a result, this topic that we're going to talk about today has obviously become of high interest and has a lot of momentum behind it for a lot of our clients. And really hats off to, the Blue Cross Blue Shield of Alabama team, because, you all were the first payer to partner with us at Magellan on a high cost therapy solution that you and I, like I said, have been personally involved in. And that's kind of why I'm so excited to talk with you about it and the impacts that it's had on your end so far. So what would you say sort of initially, your sort of takes are on the partnership in general and the impacts that it's had, for you at the plan level?
Well, as I previously said, when the partnership's been amazing. Magellan is an amazing company to work with, and I'm not even saying that because I'm on the chat with you today. I truly do mean that. You guys are great, but for Blue Cross, the impact has been positive, incredibly positive in so many ways. So it not only allows us to provide a hands-on approach, which I know we'll kind of talk about a little bit later with our membership, which allows us to outreach the members with these complex diseases, but it also allows us to ensure our customers that we're evaluating these high-cost therapies from every angle possible, from rigorous utilization management to the like specialist review and chart note submission. And then, with a nice little bow of the personalized outreach to their members from myself or a Blue Cross Blue Shield Alabama associate that really allows us to close that gap for any needs that honestly may not be visible in a PA submission. I feel like it's just a very beautiful, comprehensive approach to manage these high-cost members, to also give them the care and attention they need for their disease state.
Yeah, you bring up some really interesting points. And I kind of think about how, the different benefits that we're trying to sort of convey, with a program like ours, and also, sort of what the benefits look like, from where you're standing as well. So for us, Blue Cross Blue Shield of Alabama is a partner, but also a client, and you at Blue Cross Blue Shield of Alabama kind of have your own clients in the form of customers as well. So from the payer perspective, separate from the benefits that I know we're trying to deliver with the program, can you tell me how the high cost therapy program has actually benefited you and your customers?
Oh, absolutely. So we have found this program to be beneficial to our customers really by solidifying that we are trying our absolute best as a plan to ensure we are stewarding their funds well. So as you talked about, with the rising cost of drugs that really only seems to be increasing every moment you turn around, it is so important to be able to help our customers have some comfort in what we are doing to ensure their membership is getting the best clinically appropriate, yet cost-effective medications for their particular needs. So this program really helps us not only really execute this piece of it, but it allows us, another piece when you're, dealing and talking with customers is you have to be able to communicate what you're doing. And this program also allows us to easily communicate to key stakeholders what we're doing behind the scenes to really care for their membership. So it's been great all around, from actually executing the overall program to being able to communicate to them, because to me it really is twofold when you're dealing with customers there, that you have to do it, but you also have to be able to communicate what you are doing in a way they can digest it and feel comfortable with your involvement with their members.
Oh, very interesting. Yeah. And so how would you say, now that we are almost 2 years into sort of piloting this type of program together, how would you say that the program itself and maybe some of the initial outcomes that we've seen from it between Magellan and Blue Cross Blue Shield of Alabama, how has that helped you and your organization sort of be able to leverage better business relationships?
Oh, yes. So it really allows us to tell a great story to our customers, not only in retaining existing business, but also acquiring new business. High-cost therapies, they're not going away, and they're always a topic for discussion with our customers, whether it be old business or new business. So this program really gives us a solid way to present what we have to offer them and what we are doing in this population that is, like I said, that's really easy to understand and digest for all key stakeholders there.
Perfect. Yeah, and you mentioned kind of key stakeholders. When I think beyond the customers for Blue Cross Blue Shield in Alabama, another key stakeholder, another big piece in the process are the providers themselves, who are looking at these new to market therapies and these potentially, sort of groundbreaking or game changing therapies for patients who potentially maybe didn't have, FDA approved or at least, multiple treatment options previously for their condition. So how has, the solution been adoptable or, sort of accepted, amongst the provider base, that services Blue Cross Blue Shield of Alabama members?
Yes. So we have received nothing but positive feedback from our providers. I get to work with them a little bit on the referral side when it comes to if, you guys refer a member to me and maybe I feel like I need to communicate to the provider. And they are always very receptive of the program. They appreciate it just because they understand what we're trying to do, but it also helps them as well because I've specifically gotten good feedback around the like specialist review. They deeply appreciate that just because, when you're dealing with people, it's not always a black and white policy. There's some gray area there that these people fit in. So they appreciate that like specialist review that gives them some security in that they know they're having a second look at this with someone with their like mind versus someone just reading down a policy, which sometimes is often the perception when you think about So I have received nothing but positive feedback and I haven't received any negative feedback, if I'm just honest, in all of my conversations with them. They also, I will say this, they've also spoken very highly of the partnership with Magellan when it comes with communicating. And I think that's another thing with providers, the administrative burden is always a topic when we talk about with our providers. And they feel that Magellan has really made it easy for them to get the therapy they need, but also ensure that, ensure they understand where we're coming from needing the background, the clinical support there to be able to speak to our customers. So it's been great. It's been great. So all around, our business, our providers, and even the membership, it's just been a great experience.
Oh, awesome. That's so great to hear. The last, beyond the customers, beyond the providers, we're both pharmacists. So ultimately, when I think of any of our clinical programs, my mind always comes back to patients and the member experience and the clinical benefits, hopefully, from a program like this. So could you talk a little bit about what it's been like? You mentioned a few key things so far. You talked about clinical appropriateness. You talked about cost effectiveness. And then the last thing, you mentioned that referral process, that sort of constant ongoing communication, from our side to yours, while these high cost therapy reviews are taking place. So, what has this been like in terms of providing sort of clinical benefits for your membership?
So in addition, it really is a trifold. We have to service our customers, work with the providers, but our ultimate focus here is providing the best care we can from a plan perspective for those members. So our goal would be that they are getting the most clinically and cost-effective, appropriate treatment on all these high-cost diseases. And we want that to happen quickly, right? Not have to go through different treatment regimens we want them to get on the treatment regimen they need and be able to stay on it long term. And also, I love that they have a place to go whenever they have questions or concerns. So it really gives full circle of care for the members. Because when I say a place to go, I mean by having the referral program in place with Blue Cross, I'm looking at these referrals and I'm able to coordinate customer service, case managers, social workers, or even myself as a pharmacist to really help these members in whatever they need. So our goal there ultimately long-term would be that if we are navigating this membership, then hopefully the member will be healthier, happier, but also preventing those long-term costs down the road, such as hospitalizations, with this all-inclusive approach for them.
Yeah, I think you nailed it. And, you touched on sort of that multifaceted care team that can be available to members where it might be a pharmacist, it might be a nurse, it might be a social worker, and not necessarily having one set group or one set team or one set specialty, for members to interact with, depending on what their individual needs are. They can be matched up with a variety of different, services or teams, within Blue Cross Blue Shield of Alabama. And I know that's, ultimately it's been sort of the goal of what we imagined when we brought this high cost therapy solution, to the market. But some of that actually, just, takes place outside of, the four walls of Magellan, so to speak. So from a clinical perspective, I, as a program manager, and overseeing the program, get to see what goes on within MRX when it comes to handling these requests for these high dollar therapies during the clinical evaluation. But once our team has done that part, how do you and your team finalize and follow up with these members for whom the treatments have been requested?
Well, first off, I deeply appreciate Magellan being willing to partner with us and send us anything they see that is potential case management opportunities for us as the plan to review, outreach, and intervene if necessary. So it has really allowed myself to partner with our existing case managers, as I mentioned, social workers, just all the care team that we actually have readily available, who often work with this membership anyways. On different issues, who they may know these members more intimately, that we can make a difference in these members' lives. So we see often that the members may not have any questions around their high cost therapy that I'm actually calling about in general, but they may not understand the conjunctive therapy that's complementing their high cost drug, or even other medications, or even benefit questions. So we're able to navigate these really, really early. And I think that it provides a very member friendly approach in these disease states. So I always think I have what I think is a good example where I felt like we were able to provide an impact from this program. We had a member who was starting on Krystexxa, who was confused on what oral medication to continue while starting this infusion. He just got mixed up what the provider had told him at his appointment. So the member was planning on continuing the allopurinol and discontinuing the colchicine, which we know should be opposite. So without this referral, we wouldn't have known that. So without this referral from this program, then the member could have experienced an increased risk of anaphylaxis due to the allopurinol, or an acute gout flare-up due to not having the colchicine while starting the infusion. So I was able to talk with him about this and just really help make sure that he understood. And then I also called his provider to make sure they were aware, because of course he had follow-up appointments coming, and just to make sure we were all on the same page. So I was able to close that gap. And I mean, I'm proud to say the member's doing great and on the infusions currently. So that's really the biggest story that jumps out when I think represents something, because it's really, I mean, he had zero questions on the Krystexxa, which was the reason I called, was to check on that. But if just by talking with them and asking them open-ended questions, it really allows us to see what's going on in ways we can help from all different avenues.
Yeah, that's such a great clinical intervention for such a sort of unique scenario for that patient going to a new therapy, for their chronic gout. And when you talk about coordination of care, you talk about the member outreach combined with communicating to the provider. That's a great example of kind of everyone working together to sort of provide that best, and highest quality care to the member. It also highlights, something that our program, I think, really strives to get across, which is not that, this is not a program designed to drive savings for the sake of savings by just driving up denials and putting up, walls or barriers to access to these high cost therapies. We're working together to ensure that these potentially, life altering, game changing drugs are prescribed, for the right patient at the right dose at the right time, as we always like to say. So, these case management opportunities can present themselves regardless of sort of what the post-determination outcome is for the patient, whether it's approved or denied or an alternative therapy is found. These patients may benefit from, additional interventions and outreach, just the same. So in situations where inappropriate use may be identified, how has the process been on your side in terms of helping members to potentially find formulary alternatives?
We've really been able to help them get formulary alternatives, understand their denial. But when it comes to getting those formulary alternatives, it's actually been not what I expected at all. Like, so we've been, when members get discharged, often they're not discharged on the formulary alternative. So we're able to help them with that. We actually help them connect with a provider to manage any side effects and then also discuss medications to ensure that they're getting the best benefit from both drugs in scope and out of scope for the high cost therapy program. So I know whenever I call these members and are able to talk to them, we always discuss their high cost therapy first. It's just my easiest way of opening up the call and explaining the program. But we always talk through their different medications and I answer their questions. And sometimes it's as simple as, they're having a side effect issue with one of their just maintenance medications that's not related at all to their high cost disease. But, I can encourage them to call their doctor, and this is something that they can easily manage just with a simple phone call and talking with them. So it's been great overall for both drugs within scope and out of scope, which I think is beautiful. I knew that was the intent, but I didn't expect to see as much fruit as I have when it comes to, even blood pressure medications, cholesterol medications, just some simple counseling that you take your blood pressure medicine every day, not just when you think it's high, so it's been great. It's been great. I've learned a lot as well, Brian.
Oh, you make such a great point too. I mean, even though this program, might be designed to focus on, select, high cost therapies for certain conditions, that does not prevent a patient from being on additional medications, even, the more traditional medications that we might think of as pharmacists. So even, in such a niche program, there's still the opportunity to have those classic discussions around medication adherence and helping patients to, remember to take, all of their medications, as prescribed. Yes. I've had some very unique conversations, but it's definitely been great, and it really is comprehensive. Just kind of bringing in the first 2 points, it tells a great story to our customers. We're able to really give them a personalized view of what we're doing, but it helps me support our providers, who I deeply appreciate, in caring for our membership. And then also, it allows me as the plan pharmacist working with these members to give a hands-on approach that, not only I enjoy, but also you just see a healthier and happier member, which ultimately, that's better work productivity for their employer. And so it is a great full circle that this program has really allowed us to execute here. Oh, you're so right. And yeah, circling back to those providers, one thing that occurred to me, you mentioned earlier, talking about the availability of that colleague, that like specialist, in their discipline to assist with, the review process. And, when you think as a managed care pharmacist about sort of the foundational elements of the program, what has been your impression or your thoughts sort of on the, I guess, clinical quality and the clinical completeness that has come, through the review process? I've really appreciated just the transparency in the approval and or denial rationale. So this has helped us ensure that policies are most up to date and in line with current practice standards. So an example that really stands out is surrounding the interpretation of the TEPEZA policy. So we as the plan felt like the approvals may not have been in line with what the policy criteria and justification given by some of our providers may not have warranted approval. So, after discussion with the policy team, it was really determined that the policy was accurate, related to current guidelines, and more detail would be necessary to grant those approvals if the providers felt that therapy was necessary. So further education was provided to the reviewers, and, it gave us the confidence. So it's been a really nice partnership all around. And on the clinical review side, I feel like you guys have been a tremendous partner in ensuring that it is with current practice standards, but also, hearing our providers. If we get feedback from our providers, whether it be, great feedback or some difficulties they are having, you guys always take a look and, explore that. And we are finding ways, even today, finding ways to make it better for our members and providers. You make some awesome points, and we've covered so much, in terms of sort of the philosophical concepts behind the management strategy and how we've kind of worked together on both sides of to process these requests and follow up with the members. I know this opportunity to, work with Blue Cross Blue Shield of Alabama and other, payer clients on this high cost therapy program has been an unbelievable experience for me. And I know, in terms of the communication back and forth, and as we watch, new drugs come to the market that we continually sort of bring into the fold of the program to make sure that the program is evolving and is relevant, with the current landscape of treatments that are out there. It makes me think that, just last week I was traveling to do a presentation and a CE talk on overviewing the specialty pipeline. And if that drove home anything to me, it's that, these high cost therapies, these gene and cell therapies are certainly not going away. And there's even more, being researched in clinical trials right now, potentially to come. So, from my end, in terms of working with you, I hope this will continue to be a partnership and a program that will bring benefits to everyone for a long time to come.
Absolutely, yes. I think 2023 is going to be a tremendous year when it comes to, especially in the gene therapy world, from what I'm seeing on the pipeline. So I think that I'm very thankful we have this program in place, and we're set up for a win come 2023. Whenever just more and more these high dollar drugs, $1 million drugs are coming to market, we are prepared as a plan to do the best we can in stewarding those funds and caring for those members all in one.
Yeah, you're so right. Well, Kourteney, I can't thank you enough for making time to join us today for this edition of the Pharmacy Friends podcast. I always enjoy interacting with you. So for me, this was, just another great day, but, continuing, like I said, to look forward to, to working with you and your team, in the future.
Absolutely. Thanks, Brian. Like I said, I thoroughly enjoyed it.
Thanks, Kourteney.
Thanks.
What a great conversation on high-cost therapy management. A huge thank you to Brian and Kourteney for enlightening us with some really great insights. Until we chat again, make sure to subscribe and rate this podcast 5 stars. We'll talk soon.